What is the difference between having endometriosis symptoms and ovarian cancer symptoms? Because they can overlap so much. The main difference is that endometriosis can be cyclical, so it can be tied to your menstrual cycle. I know, before you come for me, that isn't the case for everybody, but ovarian cancer symptoms are usually more persistent and constant over time. Ovarian cancer, the symptoms rapidly progress into red flag symptoms, as we call them as doctors. So that could be unintentional weight loss or even weight gain. Look out for that. So that's the feeling that you've got a pregnant belly. So you could be having skinny arms and skinny legs, but this bloated belly, and that bloating goes on for 3 weeks or more. Or you could experience constipation that is simply not going away. And this is sometimes termed as a change in bowel habit, because it's something that you never experienced before, but now you're experiencing that. And that might be different to your endometriosis symptoms. Other symptoms like pelvic pain, bloating can also present in both of these conditions, so endometriosis and also ovarian cancer, which can make it really difficult to distinguish between the symptoms alone. So this is why you have to be so proactive in tracking your symptoms, knowing what's not normal for you, and then just going to the doctor and saying, can this be ovarian cancer? I know I've got endometriosis. But once you have it on the radar, then the doctor can be thinking about scans, so a transvaginal ultrasound scan and a blood test called CA-125. And that can help distinguish, particularly people with endometriosis who are already at a slightly higher risk of developing ovarian cancer, to get an early diagnosis, but also to be aware that we're ruling out things all the time. Now, even if the tests are normal, we still follow the symptoms. So the Overcome charity have a symptom checker on their website, and this symptom checker can help you keep a track of your symptoms, because if anything changes persistently and anything changes and it remains not getting better, then that could be an indicating factor of why we want to do a CA-125 again, or maybe doing a CT scan or an MRI scan. Now, the problem with just doing a CA-125 marker on its own is that it's not specific for ovarian cancer, so it doesn't make a good screening test. So if you have a CA-125 and it's below 35, and we say, look, that's normal, actually in other conditions, even with endometriosis and fibroids, or even if you're having periods, it can give you a false positive, because non-cancerous conditions like endometriosis itself can put up your CA-125, so it doesn't mean that you've got ovarian cancer. So you have to do the ovarian cancer screening tool, like a CA-125, alongside an ultrasound scan to get a better idea of what we're looking for. And currently, on the good news side, there is research going on to develop the HE4 blood test, which is a tumour marker which can be used alongside the CA-125 to help give us an accurate reading and testing. So I hope that explains why doing tests is so important, but the difference between endometriosis